Hi, I'm Ephraim Parent from Mayo Clinic, Florida, Division of Nuclear Medicine and Radiology, and I'm here to answer some questions about our department.
Dr. Parent, 2019 has been a big year for nuclear medicine at Mayo Clinic in Florida. Can you tell us about these advancements?
We've had a huge incremental growth over the last year, really the last 2 years, and it's been kind of been continuing, and it looks like we're going to be continuing the same projection over 2020. In terms of just infrastructure, there's been a huge increase in what we've been able to accomplish. The cyclotron building has come online and is now currently FDA approved. In terms of clinical PET radiopharmaceuticals that we're producing, we're currently making FDG, ammonia, choline, sodium fluoride, and in terms of our imaging capabilities, we have 2 new PET CT that have come on board in 2018 and 2019, bringing a total of 3 clinical PET CTs that we're able to be doing. We're now doing cardiac PET imaging, which is a new procedure that we've just recently in 2019 been able to do with our new PET CT, as well as the cyclotron coming on board. In terms of our therapies that we're doing, we've expanded our numbers. We're doing over 100 studies a year, and we've set up to be incorporating new PSMA radiotherapeutics that are coming on board. And so in terms of just our infrastructure as well as our clinical volume, they've been increasing. And in terms of our research capabilities, those are also increasing. We have approved FDA approval to be producing research-based PET radiotracers for both neurological as well as cardiac imaging. And then also we have a small animal imaging clinic that we are in the process of creating. We have a micro PET CT, as well as all the dosimetry and other things that are going along with that. So we have gone from just really doing a clinical-based nuclear medicine division. We're now having a true research type aspect on both the clinical and well as preclinical studies. So it's really kind of over, I'd say, the last 18 months or so, and this will begin expanding into 2020, really have a huge amount of our abilities to what we can accomplish.
How do these changes fit into the broader plans for Mayo Clinic in Florida?
So I think overall the Mayo Clinic's goal is to really make each site able to have the same abilities. So clearly there's more infrastructure, there's more people at Rochester, and I don't think the goal is that Mayo Clinic Florida will be able to mirror that, or Mayo Clinic Arizona. But what we've been able to do is we've been able to harmonize and have convergence with our different scanners. So we all have the same PET MR study, so that as a multi-center institution, we can have 3 different sites enrolling patients and having these multi-center trials become available. And that's a huge bonus for industry to be able to say, hey, if we're going to be enrolling patients at the Mayo Clinic Florida or Rochester, we can actually have all these 3 sites being able to do the same study. And as we have the same instrumentation, it's able to have kind of that consistency between the imaging results. Also, in terms, like I was saying, with our cyclotron and our small animal imaging facilities, we're able to do these same basic type of science research studies that have been done at Rochester or Arizona and Florida. So really, even though we're all kind of operating the same umbrella, we're able to operate independently and have our own principal investigator-led studies at the Mayo campus Florida, as well as at Arizona and Rochester.
What's in store for 2020 in Florida's Division of Nuclear Medicine?
So I think there's 2 things that are definitely going to be happening in 2020. One is we'll have completion of our small animal imaging facility, which are really going to be able to help revolutionize the whole preclinical studies that are going on at the Mayo campus Florida. To be able to incorporate our PET agents as well as what other radiotheranostics or or molecular imaging agents for our small animals, and that will really help all of the different the principal investigators outside of radiology to be able to incorporate these studies. And then the second thing as well is we will be incorporating our quantitative SPECT CT, and that's really going to have kind of a large leap forward in what we're able to do in both of our dosimetry for our radiotherapeutics, Y90, Lutathera, PSMA, as well as being able to identify how therapies are productive for our standard spec type imaging agents. And then also the other thing we'll be doing is we're actively recruiting for a new clinical investigator that's going to be able to primarily, we want to have a focus of a research-based nuclear medicine physician that's going to be able to kind of help transition us again away from a primarily clinical service, which will always have that focus, but also being able to really have new investigator-led research aspects in the nuclear medicine division.